Hi there, I'm Martha Van Dam, and this is Living Beyond. And here we are in Inflammatory Breast Cancer Awareness Month. I'm calling this whole month for me to let the news out about inflammatory breast cancer. But yesterday we talked about how physically cancer is not really ever over for us, and today I'm throwing out that emotionally and mentally, cancer is not really ever over for us. Once a person receives a diagnosis of cancer, that event in and of itself, wherever they were when they heard, whether they were sitting in their doctor's office, whether they were in the car on the phone, whether they were in the house on the phone, whether they were in the hospital, wherever they were when they got the news, they remember it. And they remember it because it came into their mind like a physical blow. It is a trauma receiving that news, because the person receiving that news knows in that moment, my life has changed forever. And then the fears begin to pour in. How bad is it? Am I going to die? What's life going to be like? Blah, 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 blah. We don't need to go into that right now. But so the person goes through the physical journey and the emotional journey of however many months it is of treatment. They may be in treatment for the rest of their lives. But whatever they go through this period of time, and very often, if they are fortunate enough to be able to reach a point where they say they're in remission, or they are cancer free, or in the case of me in inflammatory breast cancer, we aspire to reach a condition called NED, or no evidence of disease. Because with inflammatory breast cancer, they can never be really sure that there's not a little errant cell hiding somewhere. So no evidence of disease actually means, well, we don't see it. We're not willing to say there can't be anything, but we don't see it. And that's the best we can get, and we are glad to get there. But if we should get there, the common expectation is it's over. Oh, it's finally over. You can go back to living your normal life. You can enjoy it being over. We can be glad treatment is over. But the fact of the matter is, emotionally and mentally, it is never over for us. We have been changed. That does not mean it has to be negative, doom and gloom, life is misery. But the effect of going through the trauma of cancer diagnosis and then treatment affects a person's mind, heart, soul. It is very common for women, specifically women or men who have undergone breast cancer. And by the way, this particular statistic is the same for people who have lung cancer or brain cancer. But about the 2-year mark out, about 2 years, and by this time, an awful lot of them are not undergoing treatment. 2 years, the depression and anxiety level skyrockets. Because in that period of time, a piece of what happens is we've processed the initial trauma. We're trying to get back to normal life, but our mind is now aware that our body has the ability to create cancer, and our body is always on guard. So our body is always sending this message: watch out, look out. What was that cough? Is it coming back in your lungs? Your back's hurting. This cancer likes to go to the bones. Could it be in my back? I make the joke that once you've had cancer, if you get a hangnail, you get worried that you've got finger cancer. And that's not real far from the truth. I'm pretty sure that the people at the imaging office laughed when a couple of years ago I had a stretch of lots and lots and lots of back pain. I sometimes could hardly move, and it really didn't get better. And that's one of the things to look for when you're talking about recurrence or a metastatic situation. You look for pain that just doesn't get better. So I went, as is my policy, if I'm in pain or I have something that looks like a symptom, I give it 2 weeks and I watch it. If it gets better or goes away, then I go, okay, it was nothing. But if it doesn't go away and I'm still concerned about it, then I ask my oncologist about it. And they're really good to, all right, we'll order a scan, we'll check this out, we'll do blood work, we'll do whatever we need to do. So in the case of my back, lots of pain had been going on for a while, and I went to go get the CT. As I'm finished, they gave me the results right then and there, which they often will when you've had inflammatory breast cancer. So they gave me the results, and they said, oh, we see according to your scan that you have a herniated disc. At which point I go, oh, right, a herniated disc. Maybe not the result of the response they're used to getting, but believe me, when you've had something as aggressive as inflammatory breast cancer, you get excited over an over a herniated disc. It's not cancer. And if it's not cancer, I am happy. So our minds, though, because of this, our minds are always alert. Even if we're paying attention to other things, there's a little awareness in the back of our mind that cancer could be close by. And so for that reason, we're not ever completely 100% free of it. I heard a wonderful analogy, and I hope this will be helpful to you. The analogy was that if someone is walking behind you with a gun in your neck, you're going to be very aware and you're going to be panicky, and that's all you're going to think about is that person standing there with that gun. I'm scared, I've got to do everything right to try to keep myself alive, and we do that. As we get more and more used to the pressure of that gun on our neck, we begin to live our normal lives, and we can almost forget about it, and we get busy and we have full lives and we do fun things, but every now and again, that little pressure, that gun, it just puts a little pressure, kind of like a reminder, I'm here, I can come back at any point, don't you forget about it. And so as much as I'd like to say that, yes, we're over with our treatment, we're happy that it's over and we're good now, it so often is not the case. And also one more thing that tends to then affect the mind is that since we've mentioned so many of the physical things that continue to hang on because our bodies have been so wounded by the treatment itself, our minds can get tired from the physical things that are going on. So if our body is always feeling tired, if we have places that always hurt, if we can't reach and do things we used to do, if we can't hold and lift maybe a child that we used to be able to do, then we're going to have feelings about that. It's going to be one more thing that feels like was lost to us. And so each time there's a thing, an effect that we have, that may be a physical effect, but our mind is also responding. And so each time that happens, we're in the position of deciding, what am I going to do with that? Am I going to feel sad and mad, or am I going to work through it and I'm going to find a way to twist it and then be positive about it and find my way to be happy anyway? Yes, but that takes a lot of mind work, doing all of that. So if it's you, and you are the breast cancer or inflammatory breast cancer or any cancer patient, and you're struggling with things of the mind following your treatment, first of all, it's normal. The majority of people who have had cancer struggle with the mind piece of it. So please don't beat yourself up. Please, on top of all of this, don't beat yourself up for struggling with some of the mind piece. That's number one. Number two, if it's you, then take care of your mind the best way you can. Feed it with all of the things that are helpful for mind. Read nourishing books. Listen to encouraging music and things that settle the soul. Do physical activity that helps our minds be healthier. Exercise if you can and as much as you can. So if you literally are still, I knew of a woman, the radiation from her inflammatory breast cancer did so much damage to her ribs, her rib cage, and where the cartilage is there at her sternum. It did so much damage, I think it fell apart. And they tried to do different surgeries to sort of recreate that for her. But she still was in really bad pain. And to the last I knew, she was spending a lot of her time bedridden because what they had tried to do didn't work to rebuild her another rib cage. Well, that's a physical issue, but oh my word, what does it do to a person's mind and psyche? So not everyone has to face something like that. In fact, that's incredibly rare. She's the only person I've ever heard of it. I wouldn't want you to be afraid that that's going to happen to you. It is a rare occurrence. But please be understanding that cancer patients, since our bodies have changed and our minds have undergone this trauma, then we don't go back to normal. Actually, we never go back to normal. We find a new normal. And by the way, sometimes we get tired of hearing that because we'd rather not create a new normal. But we find a new normal, and that helps with our mind piece. Be aware that the person that you love that has had cancer, and they may be far away from their cancer, but please be aware that they may still sometimes struggle with some of the mind piece of it. And you can be supportive by asking about that, by being in tune to it, by being aware, and also sitting with them if they happen to be in a difficult place. The depression, the anxiety is real. It's not unusual, and it can be treated, but be sure that you treat it. See a doctor, see a counselor, a psychotherapist, and get that taken care of. It doesn't have to keep you debilitated all of your life. Thanks so much, my friends. Bye-bye.